It's time for Wellness Wednesdays with the Okoboji Wellness Clinic. We have Dr. Bradley Meyer joining us today. Good morning, Dr. Meyer.
Good morning, Nathan.
How have you been? Have you been staying warm?
Well, I was out scooping the snow in front of the clinic this morning, and I was very thankful for some warm gloves, and it was cutting to the bone. So,
Oh, yeah.
yeah, trying to stay warm.
Yeah, it's going to get cold, so... All right. Well, Dr. Meyer, you have a story you'd like to share about a concussion case that you guys are going to be helping someone out with.
Yeah, it's whatever the case may be. It's a privilege to always have somebody show up that is there because, number one, they want to be here. They want to be at the Okoboji Wellness Clinic, and they're just very much open to the path forward by any means necessary. We see it. We catch a lot of cases that are pretty difficult and have these folks that have been through sometimes a 2 or 3 year medical workup in the conventional system, and those folks that aren't getting the traction just yet. And those folks many times come in search of hope. And so sometimes just to reassure them that it's not all in their head, and specifically with traumatic brain injury related cases, when you have a traumatic brain injury, as is the case with this gentleman, you can lose the control mechanism in the brain, and so everything can go haywire, and it can, the signaling throughout the body, and I tell you, this can have quite an impact on their own lives, their family. And so to the point where we'll see many folks that come in and have difficulty with sleep at night. They are very tired. They've got difficulties with focus, brain fog. They will come in and say, hey, Doc, I'm more irritable, or I'm more anxious, or I'm more depressed. And there's an actual cause for that, and it's the glial cell activation in the brain tissue that gets ramped up, and you get an inflammatory cycle going. And once we have any kind of trauma to the brain, leaky gut. And so we start to look beyond the brain. And some individuals can also come in and say, hey, Doc, I'm bloating too. And so, what we're trying to do then is, as we often talk about, is peel those layers back on the onion, so to speak, and give the individual hope. Because, this gentleman, for instance, many years of multiple tried and failed prescription medications that had many side effects, spinning the wheels, and having just getting by in his day-to-day life. So that's what we're here for, and it's such an opportunity, a blessing to kind of focus beyond just the hyperbaric therapy, which is going to be a key factor for him, but into some of these other modalities as we move forward, such as ozone therapy, neurofeedback, working with the brain on some brain treatment tools. It's a multimodal approach, and to see that individual's face filled with relief, because so many times, Nathan, that folks come in with brain-related conditions, they're not given a whole heck of a lot of options. And they're told, well, in the case of a concussion, just give it time. And in 2 to 3 years now, beyond that, in this case, and that without improvement, spinning the wheels, we're excited to be there to see that progress forward and do it in ways that are going to, again, be outside the box. Sometimes you ask, why didn't my neurologist talk to me about this? And, that it's, again, typically not a big part of their training outside of the conventional imaging and pharmaceuticals, and maybe some physical therapy, occupational therapy when it comes to trauma, brain trauma care. And so a great blog that's out there is the Midwestern Doc right now, and he's kind of came out during COVID, conventionally trained MD, and he's going down a lot of different paradigms from treatments for many chronic conditions, and this includes statins. One I read recently was on DMSO for pain management, and it is just a fascinating story to look at. Conventional doctors now over the last 3 years start to dig into areas outside of our training. And so it should be an exciting time for humanity that haven't gotten the answers, because more and more answers are coming to light every day. And I always talk, there's an infinite amount of possibilities to find an answer to get to where we want to go. And that's balance in the body, quality of life. And utilizing these tools, many times we talk about the therapeutic window, and what is a medication, whether or not it's ozone, hyperbarics, it's neurofeedback, it's a supplement, or it's a pharmaceutical. Every treatment has a therapeutic window, and I think that's such a key for folks that are looking to find improvement in their life and balance. It's why you want to work with, because there's so much great information out there now that's hard to sift through sometimes on the internet. So, for instance, a little bit of something might not be very good, might not help. A little bit more might be very helpful, but a little bit too much might be too much, and you might see the individual not do so well. And so it's very much a waltz, it's a dance, it's an art, utilizing the different tools and the different medication regimens, whether more holistic or pharmaceutical based. Therapeutic dose is a big factor. So, and that's a big one. It's like the three bears with the porridge. We got to find the one that's just right, whatever. And the body, when we're exposing it to a treatment, we often utilize the term called hormesis. So hormesis is a little bit of stress on the body to create a response. And sometimes we're doing this with a treatment, a protocol, but kind of in totality, Nathan, that's where we're aiming to go. So again, this gentleman, just the relief in his eyes as we work together is so gratifying, and I want that for more people. I want more folks to say, okay, we can work to find answers, and we don't have to just accept that this is what it is.
Yeah, great information as always, Dr. Meyer. You guys are very easy to find, and it's easy to schedule a consultation.
Absolutely. You can give us a call at 712-339-6024. And we are at 3305 Brookwest Avenue in Spirit Lake, just off Highway 71. I do complimentary discovery calls for folks for 15 minutes to kind of discuss what's going on and seeing how we may work together to implement a plan. And of course, you're always welcome to come into the clinic if you want to stop in. We had somebody in yesterday that had stopped in 2 weeks before she met me for a visit, and she just wanted to get a feel for the space and what it felt like, and walk through the clinic, and we're always happy to do that. So wish everybody a warm day, stay warm, and please give us a call.
Thank you so much, Dr. Meyer. You stay warm as well, and we'll chat again soon.
Take care. Bye-bye. Be well.
That's Dr. Bradley Meyer of the Okoboji Wellness Clinic. Again, they are with you all the way through your wellness journey. Give them a call, 712-339-6024.